I'd like to introduce Carolina Milesi, who will discuss the analytic purpose of linkage and estimating feasibility.
Hey, good morning, good afternoon, some of you. I will, can you see my screen? Amber, can you confirm that you can see my screen?
Yep, you're good.
Great. Okay, so as Amber said, the main purpose of today's session is, the main purpose of today's session is to talk about the analytic purpose of the linkage and how to determine the feasibility of the linkage. So for the purpose of the linkage, so far you have you have mostly covered kind of the administrative data side. And now we're moving into the linkage territory, where it's not just about assessing the quality or the feasibility of accessing the administrative data part, but actually the linkage of the two. And that's what we will cover, the why and the how. And we will focus specifically on the analytic feasibility of the linkage, but there are other aspects of it that I will touch on briefly. Yesterday, Zach covered the data quality of administrative data, how to define data quality, the key criteria, how are administrative data different from survey data, and aspects of error, as well as data quality and how to assess that. All his emphasis was on the administrative data side. That's why today we will talk a little bit about the quality of the linkage for your specific analytic purposes. And then he also talked about some of the kind of operational side of things that you need to keep an eye on, such as the legal obligations, data use agreement, and informed consent. Are there any questions about yesterday's session? Okay, so I'll get started. Let's talk a little bit about why you may want to link survey data and administrative data. So I will spend a little bit of time on this slide, and this is based on literature on linkage between administrative and survey data, and also and some of the examples that I have come across in my own work or in reading the work of others. So the administrative data may be used as an outcome, and standard examples here is that your outcome is the participation in social welfare programs or any benefits such as CCDF, which is very relevant for the ECE world, or the outcome may be like an interaction with the criminal justice system. And some of the features that these outcomes have in common is that administrative data is commonly used when the outcome is difficult to report by survey respondents because it's either they don't know about it, they have limited information, it's too burdensome to collect, so you need a lot of survey time, which is expensive, to collect that information, and you may want to rely on administrative data. It's also the case that administrative data is used likely as an outcome when the outcome that you are interested in is likely to be socially desirable or socially undesirable, and therefore you may have a case of underreporting or over-reporting. And it's very common in the case of income, for instance, of if you want for income to be your outcome, that the report of income varies a lot by education level and income level of the households, such that households that tend to be low income tend to underreport income, and also low income households tend to underreport their participation in any sort of a subsidy program or social welfare program. And this has been reported across various types of programs. So the other reason where you may use administrative data is as an additional covariance. So a typical example here is that you use administrative data for contextual information, for school districts or census tracts, or variation in policies across states. And some of this contextual information may already be included in your survey data file, and some of it may not. So for instance, in the NSCCE public use files, we have added what we call the community characteristics, which are based on ACS data from the American Community Survey on the areas where providers are located. And so that's already available in the data file. However, the NSCCE doesn't have information about policies across states. For that, you will need to access the restricted data and kind of do that linkage yourself. And that varies across data files. So in this case, your analytic purpose is your outcome data will still come from the survey data file, but the additional covariance or contextual information or any kind of subgroups that you want to do would be from the administrative data side. A third reason that you may want to do the linkage is to fill in missing elements in the survey data. And this may be because you have item non-response on, for instance, some subgroups within your survey. And that's very common in intrusive items or difficult to answer items. Or you may need information on other members of the household, subfamilies, non-resident parents, or prior generations. So, for instance, the Census Bureau here has done a lot of work trying to link current households with the parents of the household members or the grandparents of the household members. And obviously, it's hard to get that information from the household residents because you may not know what your grandmother's education was, but you could obtain that information from linking different administrative data. And the identification of subfamilies within households is also a challenging issue, or information on non-resident parents. And in some of those cases, the administrative data could help you fill in those gaps. A fourth reason may be increased coverage of survey data. So this is common in hard-to-reach populations or in frequently underreported subpopulations. So there may be, for instance, cases in which you want to understand providers in particular geographic areas, either a rural area or some reservations, and the survey data doesn't cover that, and you may want to reach kind of link the administrative data to supplement the survey data. Another example here is I was involved in, not in an NSCCE related project, I was involved in a project that linked survey data with mortality records. So this was a survey that had been collected almost 25 years ago. And when we tried to reach those respondents, we got some responses such as, no, he has actually passed away. And we wanted to make sure that whether that was accurate or not. So we reached to the mortality records and were able to ascertain whether the person had indeed been deceased and what the cause of death was and the state in which they had died and the date of death. So obviously we were trying to increase kind of the coverage of the survey data and mostly kind of understand why some folks hadn't been able to answer our survey. Finally, you may want to use administrative data to correct or adjust the information reported in the survey. So for instance, you may want to evaluate the accuracy of reporting on program participation and benefit receipt. Or you may want to evaluate the extent to which eligible individuals on households take advantage of programs. So usually in the administrative data, that data file will include the individuals or the households who receive the program, who receive the benefit of the program, but you do not necessarily have the full representation of the households or individuals who are eligible to receive the program. So by matching the survey and the administrative data, you have both. You have the population that is eligible, and then the administrative data may give you the population who, in addition to being eligible, actually received the program. So it's very common to use the linkage, the linked data for that analytic purpose. And another example here is local price adjustment to survey data. So in the NSCCE, for instance, this is available. We collected information on households' cost of care, on providers' price, the prices that providers charge for care, and a household income, and staff wages and directors' wages. And that, because the data includes all 50 states and DC, there's quite a lot of variability in kind of what that dollar amount represents. So we have done some local price adjustment using non-NSCCE data and have been able to link the adjusted prices, income, and cost of care to the NSCCE data. So that's kind of a summary of the purpose. Any comments or questions? Okay, so let's brainstorm a little bit. In session 2 yesterday, Zach identified various potential sources of error in administrative data, such as coverage and measurement error, as well as criteria for assessing data quality. So I would like to for you to think about kind of how that content, that lecture gets combined with the different purposes of administrative data and survey data linkage. So in the table here, you see all the different purposes on the first column. And then the question that I have for you is, would you be more concerned about coverage or about measurement error? Or is there a specific aspect of data quality that you would be concerned about if you were using the administrative data, let's say for outcome, as an outcome versus a covariate, or to fill in some item non-response versus increase the coverage of your population of interest? And we don't have to go into the subgroups, but if you could unmute your phone and speak up, that would be great.
Hello, can you hear me?
Yes, we can.
Yeah, it's Donna here from Australia. I mean, this is a tricky question, but just to open a conversation up, I guess I'd be more concerned about measurement error. I mean, I'd be interested in for the outcomes, the measurement error, and also for the covariates. Just to ensure that what I do end up with is accurate. But I mean, of course, all things are important, but I think we tend to forget measurement errors sometimes. That's all I need to say.
Do other folks agree, or do you want to make the case for coverage?
I guess it's kind of related to the external-internal validity that we talked about last time. And so for the external validity, I would be concerned about coverage, because if the relationship that we find does not generalize to all, like the whole population, but just some sort of biased subsample of it, then that might be a problem depending on the question that's being tried to answer using the data.
And for which purpose of linkage do you think that external validity is of highest concern?
the outcome.
Mm-hmm.
And
I'm
to some extent,
nodding,
the
not because it's
covariate.
right, but it's it's a good option.
Interesting, yeah. I mean, I guess to some extent the covariate. So if there's a relationship that I'm interested in, and a subpopulation that I have because of skewed coverage has certain values of the covariate, but those values are in a sub-range, and I'm not able to see what's happening at a different range of the covariate, and maybe there's not a linear relationship, but some sort of nonlinearity, then I would not be able to see what the relationship looks like in the different range of the covariates. So I guess both outcome and covariate.
Okay. Great. So let's move into our exercise. So here I would like to ask you to divide yourself into the two groups, but let me go over the exercise first. So I would like to consider two alternative linkage scenarios. So in the first scenario, the administrative data corresponds to child's assessment scores from 5th grade. So you have some administrative data on test scores, and you're able to link those with children's CCE experiences, and the children's CCE experiences are coming from the survey data. And the research question you're interested in is whether participation in center-based care at age 3 is associated with higher assessment scores in 5th grade compared to children who at age 3 were exclusively cared for by parents and controlling for socioeconomic characteristics. Okay, so you have survey data at age 3 and you have administrative data in 5th grade. And you want to understand the relationship between ECE participation at one point in time and assessment scores at another point in time. In the second scenario, you also have administrative data on test scores at the same time, in 5th grade, and you link that administrative data file to children's CCE experiences in after-school arrangements. So this happens at the same time. There's no time gap between the two measures, but it's about after-school arrangements. The research question you're interested in is, do children who participate in publicly funded after-school programs targeting low-achieving students have lower academic achievement compared to other after-school arrangements? So the after-school programs that you're interested in are after-school programs that are, first, publicly funded, and second, these are publicly funded programs that target low-achieving students. So you want to know whether the children in those programs have lower academic achievement than other after-school arrangements. Is that clear? Okay. So the issues I would like you to consider is, one, what is the purpose of the administrative data? We reviewed 5 different purposes. You could use that framework to answer these. And what would be 4 critical tabulations to help determine if the project is feasible? So the idea here is not for you to say, well, it's not feasible, I'm giving up. It's mostly, okay, this seems like a challenge. Maybe coverage is a challenge. Maybe measurement error is a challenge. Maybe there are other concerns you may have, but how can you kind of assess that concern? What is it, a percentage or an association or a correlation or a count that you may develop so that you can determine if you want to move forward or not, and the extent to which the problem that you have or the data quality issue that you have is indeed affecting your estimates. So it won't solve all the problems, but it will give you a hint about kind of other things that you may be concerned about, or things that you can kind of clean up off your list of concerns. Is that clear? Any questions about the exercise? Okay.
No,
So
that's fine. Yeah.
yeah. So why don't you, Amber? Can you provide instructions on how to divide up?
Yes, if you go to Canvas and find your groups icon in the global navigation bar, you will see your conferences for session 3. You can click join, it's already open. You can use the chat on the right sidebar. I see some of you have already started. If you have any difficulties, you can use the Blue Jean chat to let us know. Thank you.
Thank you. And I will give you 5-minute warning and a 2-minute warning.
Madeline, I also don't think that we heard your audio, but you can test it when you're ready.
Okay, thanks, Bianca. I'm trying it now. Can you hear me now?
Yep, you're good.
Huh, weird. That's what I did before, but I must have gotten it wrong somehow.
You're
Okay.
fine. Mm-hmm.
Are folks able to connect? Amber, can you verify that?
Yes, they're discussing in their groups now.
Thank you. Okay, so now is the 5-minute warning. Okay, so now is the 2-minute warning. Okay, let's reconvene. I'll, so let's start with group 1.
Okay, I think I am reporting for us. We agreed that the purpose of the admin data in both scenarios was for the outcome, since the 5th grade assessment scores was the admin data, and that was your outcome variable. And then we mainly talked about how in both scenarios you want to make sure that there is enough overlap between the children in either the early childhood programs or in the after school programs and those that you have admin data for, or else basically your sample sizes would be too small to run any kind of analysis. But that's kind of all we got to. We talked a little bit about how we weren't exactly sure what the second issue to consider was asking for.
Mm-hmm. So what may be some of the issues that challenge the fact that you have adequate coverage kind of in the survey side or the administrative data side? Let's discuss, scenario 1, for instance.
There may not be very good data on a child's early childhood experiences before they entered a public system with better record keeping.
I see, but your ECE experiences are coming from the survey side.
From the survey data.
Mm-hmm. So, for instance, one concern you may have is if the children move out of the district, or if there is a lot of transition, and you may lose them. They may move to an area where you don't have the administrative data for, unless you have kind of every school district in your sample for the ECE side of things. You may not, you may lose them. And that's particularly concerning if the kids who you lose the most are related in some way to either their ECE experiences or your outcome, their test score data. So if the kids who move the most are those who, let's say, didn't participate in ECE or participate in ECE with less hours or in lower quality centers or anything like that, and in addition to that, they're also the kids who have lower test scores, then that may be of particular concern to you.
Perhaps another issue would be that socioeconomic characteristics could change between the two times. And so I guess you have to be very clear on that you are controlling for socioeconomic characteristics of a child at one time, or I don't know whether that would come from the survey data for early childhood, but then perhaps, the change in their socioeconomic characteristics could also be impacting their 5th grade scores.
Mm-hmm. Yeah. Yeah, the fact that there is a time gap between the two certainly affects kind of the meaning of your covariates if they're coming from the survey side. And Bethany, did you come up with an example of like a table or an estimate or something that could help you understand both the feasibility or how to move forward?
We did not discuss that. I don't know if anyone else in Group 1 has any thoughts about that or not.
Okay, let's move to Group 2.
So this is Marina. I'm going to be talking about what we talked about in Group 2. We sort of came up with a lot of similar things like the children moving, but one of the things that we talked about that's in addition to what Group 1 talked about is the sample size and thinking about that, whether or not that would be sufficient, especially considering we're looking at least in the survey data to see if we can link it that way, because we'll be looking at children who were at center-based care and in a particular area. Let's see. And also,
Marina, a clarification question. So your concern is that there may not be enough children at age 3 who participate in center-based care?
yeah, especially we were also thinking to start at a certain state level, so we wouldn't have to think or deal with, because another concern would be measurement errors, or not errors, but units between states. So thinking about a state level analysis, then we would have to think about if we have enough kids who participated in the survey for that year, and we're also in center-based. So considering all those factors needed to align, that would be our concern in thinking about it from a feasibility standpoint. And I think we covered the others, like the time gap came up. So that's what's in addition to.
Do you have any concerns about the second scenario?
We didn't quite get that far, but some of the things might be a concern with sample size, especially given that not all of them may or may not go to after-school programs. And since they specifically target low-achieving students, that might also reduce the number of kids that get those programs in the first place.
Mm-hmm. Yeah, in a way, you have 3 different conditions going on in scenario 2. You need to have kids who attended an after-school program. It has to be a publicly funded program. And it has to be a type of program that targets low-achieving students.
Correct. I don't know if anybody from the group wants to add anything else.
Seems to me that in scenario 2, though, you have kind of two different purposes. On one hand, the purpose is for the test scores to serve as your outcome, and in the other, you are trying to assess whether the program is actually targeting the right set of children, or
Right.
the intended. No, I mean, it's not the right set of children, but it's kind of the intended population
Right.
of children. So in that case, the use of administrative data is not exclusively as an outcome. You're trying to evaluate kind of the coverage of the program.
Yeah, this is Madeline from Group 2 too. I think we didn't think about that. I don't know that any of us have a working familiarity with the NSECE to know that that wasn't a variable that was coming from that, and that we needed the administrative data for that purpose.
I see.
I have a quick question though to clarify. So you listed out before that you could use it for outcome, additional covariate. So where would you list that concern of whether or not it's used as intended?
Mm-hmm. Let's go back there. I would think that it's the last purpose, because it's part of you're trying to understand the extent to which your program is targeting or is evaluating the kind of among those who are eligible, who is taking up or having access to the program. Any other? Oh, come on.
I don't understand that. So it sounds like we will be confusing outcome with some sort of demographic information. So the fifth grade scores are outcome, and I don't think we can use them as like a determination of eligibility for a program, because it happens so many years after the program. And so I think it would make more sense to use the demographic information in the NSEC household data to determine, maybe using income or some other information to see if, to sort of determine which children should be eligible for the intervention programs.
But in the
I just don't
second
understand.
scenario, they
Yeah.
happened at the same time. So in the first scenario, there is a time gap between the survey and the test scores.
Oh,
And in
okay.
the second scenario, they happen at the same time.
Okay.
I don't know if that answers your question entirely, but that was part of this setup.
Oh, I see. So I guess, but they would still. So what would be the timeline? Which one happens first? Or
I think
guess
they
it's
were
kind of.
supposed to happen at the same time.
But if you want to make an argument that the participation in the after-school program affects their academic achievement, you would need to know if it happened before, right?
Yeah, the
Otherwise, it's
question is not
confusing.
necessarily about the association. It's mostly about the whether the children who participate in the after-school program that is supposed to target low-achieving students has a different composition than other after-school programs.
Okay. So it's not obvious which one is the outcome and which one is the covariance.
Exactly, because it's not necessarily a question about cause and effect.
Oh, okay. Makes sense. Thank you.
Okay, so before we move out of the purpose, I thought that it would be useful to kind of have a checklist of the some of the considerations you may have in terms of the purpose of linking administrative and survey data. So in terms of the variables that are coming from the survey and the administrative data, it's important to know what to do if there are inconsistent reports. Do you consider that as an error? Do you consider that as part of the question that you are interested in understanding? Are the matched cases and the unmatched cases both interesting to you from an analytic point of view, or are you only interested in the matched cases? So for instance, in the example about mortality that I mentioned before, it has nothing to do with ECE. We were interested, the matched cases were those cases who had been determined to be, those individuals who had been determined to be deceased. So we were particularly interested in them. However, the non-matched cases were also very interesting to us from an analytic point of view because it meant that they had no record of mortality and they were supposed to be alive and ideally contacted by our, included in our survey. And the second issue is the coverage from survey and administrative data. So what's the impact of that coverage in your analysis, and what's the impact of the selection of the unit in your analysis? And we will cover that in a minute in the other analytic issues. Okay, so let's move on to the how. So this is the feasibility of the linkage between administrative and survey data. So I'll talk first about some of the very basic, they're not very basic once you're in it, but they're kind of the first hurdles that it's important to take into account when carrying out the linkage. And Zach referred to some of these yesterday. So first is whether you actually have access to the survey data and to the administrative data. And there may be various levels of access required for the various types of data. So for instance, in the NSECE, as Amber said in the first session, you can download the publicly available files from ICPSR. The first level of restricted data, which we call the level 1 restricted data, you can go through a process at ICPSR and get access to the data. But for linkage purposes, those will be part of the level 2 restricted data. And so it's kind of a different level of access that has its own set of rules. So it's important for you to be aware of that. And For administrative data, you will have the same issue, most likely with a different organization. Then you may require project approval, and most likely this will be by multiple organizations, because the administrative data and the survey data may not be housed or stored in the same organization, so you may need approval from various sources. Sometimes the administrative data may be publicly available, and sometimes it may be restricted as well, so you have to go through their own level of access. And in some cases, there's a specific infrastructure that you need to be aware of. So in the case of the NSCCE, we have a system where you can access remotely, so you need your computer and a secure connection. So that's kind of the infrastructure is relatively minimal. But in the case of other federal surveys, you have to go to a specific place to do the linkage. You cannot do it in your own computer, so you have to go there. You have to request specific software if you want to, and you need to make sure that you will leave or can access the 15 or so, research data centers available in the country. So, in the case of other data sets that are restricted and with potential linkages, you need a computer that is not connected to the network, and you need to set up a specific room for that. So that's kind of the first set of issues you need to be aware of. Then another aspect of feasibility is whether there are common identifiers. So in order to do the linkage, you may need you will need some common identifier across the data sources. And those common identifiers sometimes are readily available, and sometimes they need to be created. Sometimes the researcher does the linkage, and sometimes the linkage is done by someone else. So for instance, in the NSCCE, we have done both. In some cases, in the case where, for instance, in which you want to link the NSCCE data with some state characteristic, we give you the state ID, and you have your own state characteristics, a data file with state characteristics, and you do the linkage yourself. So you have access to the identifiers, and you know exactly which cases from the survey go into each state. But there is some more restricted data in the NSCCE in which we do the linkage. So you would have access to a mask ID, a simulated ID, but not the real ID. There are some cases also in which the access to the matched records only. So for instance, there may be a case in which you link your survey data with some program participation, and all you do is all you have access to are the matched records, but not the unmatched records. And that may have implications for your analysis, or at least for the feasibility, kind of your understanding of the data quality of the match, because you may not know what proportion of cases actually did not match, or the characteristics that are different between the matched cases and the unmatched cases. I want to touch briefly on disclosure. So disclosure is the disclosure risk is the concern that the respondents on the survey side or the administrative data side could be re-identified through the process of linkage or analysis. And this will be covered extensively in session 5. All I want to say at the moment is that sometimes the disclosure guidelines are strict enough that it's important for you to be aware of them up front, so that you may need to slightly alter your analytic strategy based on the disclosure level. So I think it was Marina who mentioned the issue of for scenario 2 or for scenario 1, you were thinking about kids attending ECE in a particular state. And let's say that your sample size is very small, and therefore you cannot report data, report those estimates. So maybe you need to think upfront about whether you can combine data from 2 states or from multiple states. So instead of doing state level analysis, you do a national level analysis. So this is what I mean here by you may need to carry out the analysis at a different level of aggregation than originally intended, depending on your disclosure concerns. it's possible that you may have to suppress some of the estimates you produce, or you may have to mask the findings in some way. So for instance, you may be able to do a state level analysis, but you may not be able to report the name of that state. You may only be able to report that it was a state located in the Midwest of the country or something like that. And this is a common procedures in survey data, and they also apply even further, even more to linked data. So I want to spend most of the time here. So the question here is whether it's feasible to conduct the analysis from an analytic point of view. And some of the key considerations are listed in the first column, and you already alluded to this when you were discussing scenario 1 and 2 in the first exercise. So the first one is your sample size sufficient for your research purposes? And some of the potential issues that you may run into here are you do not have enough power to do the analysis as intended, or you may not have enough power to do the breakdown of your analysis in 5 or 10 or 20 different subgroups. You may only be able to do a few. And the other issue is disclosure, as I was just mentioning. So disclosure is usually related to some extent to sample size. So that's also a consideration to have. And some of the ways that you can address this, or at least kind of understand the issue better, is to do a back of the envelope calculation of the relevant sample size. And this is something that Rupa guided you through on the first session with the example of CCDF in Pennsylvania. Or you could redefine your subsample. So in the case of a single state, you may want to do combine different states, or in the case of for instance, children who are only infant and toddlers, you may want to expand the age range, or any of those different analytic considerations. The second issue is whether the unit of linkage is the same across data sources. And this is a very common concern when your unit of linkage is related to geography. So you can imagine, for instance, that the administrative data is at the census tract level, but the survey data wasn't collected at the census tract level. Instead, it was collected at the county level, or at the regional level, or at the state level. And so then you need to think about kind of the unit of linkage, whether it's the same or not, and then the representativeness of the data on the administrative data side and the survey side. So you may be able to link the data at the census tract level, but the survey data is only statistically feasible to produce estimates at the state level. So we will talk a little bit further about this in the next session when we talk about the difference between the unit of linkage and the unit of analysis. But this is also a kind of a feasibility concern that I would like for you to be aware of. So the kind of a way that you can get a handle of this or mitigate this is potentially aggregate the geographic units used in the linkage and or the analysis.
Can I ask
go
ask
ahead.
a quick question about that? Just because I'm new to the linking, can we often hope that the linkage is something like a social security number, or is it going to be usually a name, which then has a lot more room for error and mistypings or different spacing on different sources?
Mm-hmm. Yeah, so you're thinking about a linkage unit that is at the individual level.
Right, like the previous two scenarios would have both been an individual level linkage, right?
Exactly. Yeah. And I also think that this will be covered in session 5, but there are different types of linkage as well. So you could have a direct linkage, an exact match, meaning, so for instance, the example of a state will be an example of a an exact match, where all the cases on the survey that belong to Pennsylvania get linked to the state characteristics of that state. For individual record linkage, it's quite common these days to do a probabilistic match in which you combine multiple criteria. So it's not a single criteria such as your social security number, but instead it's a combination of criteria of name, social security number, date of birth, but maybe address and things like that. And that's very common precisely to avoid the type of issues you have, different spellings, or one number in the social security number that was typed wrong or something like that.
I see. So it's looking to match them on all 4 criteria at once, or saying that like if 3 match, but this number is different between these 2, this one's still a probable match.
Yeah, and you may be able also to assign weights to different criteria. So you may weigh more heavily the SSN than the last name, for instance.
Okay.
So in that sense, it's probabilistic.
Great. I look forward to learning lots more about that.
Yeah. In the example that I gave you of my mortality study, it was a probabilistic match, and the criteria for matching was, I think there were almost like 10 different criteria. So it was social security number, first name, last name, maiden name, sex, state where the person had last been seen, marital status, race, ethnicity, I think those were, and date of birth, or age. So it's it's possible to use multiple criteria. Okay, is there, and then I think I think Zach referred to this. So when the NSCCE linked household data to CCDF receipt, they did a probabilistic match at the individual level, just as a reference. And I think Zach in his slides from yesterday has the link to that report. So another concern is the 3rd row here. Is there adequate variation to support comparisons? And I think Marina had mentioned this. So in the case of scenario 1, is there enough variation in the subgroups that you need to compare? Is there enough variation, let's say in socioeconomic status or any other characteristic, or even your outcome, between the the group that in the case of scenario 1 had attended ECE versus the group that had not attended ECE? And that's something that you can do by either reviewing the data or reviewing the publicly available documentation or reports based on the data. And then a second concern here related to this is endogenous variation. So the causal inference literature has lots and lots and thousands of discussions on this, and the issue here is whether there is a a 3rd variable, let's say, or a 3rd construct that is related to both your key characteristic, your key covariate, your cause, and your outcome, or your key dependent variable. So for instance, in the case of we discussed this in the case of the first scenario. What if socioeconomic status were related to both ECE usage and test scores? So it's a kind of a 3rd variable that you have to be concerned of. And in the case of scenario 1, you happen to have data on socioeconomic status, most likely from the survey data at age 3, but in some cases you may not have information on that variable, and that's something to be aware of for your analysis. And finally, is data quality related to the outcome? Is either poor measurement or under coverage related to the outcome in a way that is non-systematic or non-random, and therefore a concern for you? And the standard ways of dealing with this is to conduct a bias analysis or sensitivity analysis of various ways of breaking down your population and understanding the extent of the problem.
Sorry, this is Ting Ting. I have a quick question.
Sure.
about the endogenous variation. So for that issue, can we use the instrumental variable approach to
You could if you
address
find the right instrument.
Okay. Okay. Thank you.
Yeah, that's certainly a strategy that people have used.
Thank you.
Okay, so let's talk about exercise number 2. So we are going to propose the following scenario. I'm calling it scenario 3. And this is a scenario that has been used by quite a few teams with the NSCCE data. So the idea is that the survey data is coming from the NSCCE. You have data on center-based providers, and the administrative data is coming from something like the CCDF policies database, in which you have state-level data on subsidy policies. The research question is whether states that have more generous policies, such as a higher reimbursement rate, have different levels of quality. And in the NSCCE, quality wasn't observed. It was reported by the providers. So we usually refer to it as predictors of quality. So the question again is whether the states with more generous policies have different levels of predictors of quality among their center-based providers. The question that I would like for you to consider is, what is the purpose of the linkage? And what are some of the key feasibility considerations in terms of your analysis? What identifiers would be used in the linkage? Are there any issues about coverage that, in the survey data, the NSCCE or the CCDF policy database that you may want to be aware of? Is there a sufficient sample size? Is there adequate variation? What about the quality of the data on both sides, the administrative and the survey, and any other issues you may think about? So you can select 2 of these feasibility considerations, describe the concern, and suggest kind of a mitigation strategy. So again, the idea is not to give up and say, well, I'm not doing this project anymore, but rather to think about kind of how can you better understand the issue, what tabulation, what percentage, or what other sensitivity analysis you may be able to conduct to assess the issue. And part of that, I want to show you the following slide. So this slide shows dates that have various levels of unweighted counts of providers, center-based providers, in the 2012 NSCCE. So these are center-based providers serving children 0 to 5, not yet in kindergarten. So on the left side column, there are the states that have 50 or less unweighted cases, meaning 50 or less rows in the data file. And in the NSCCE, in center-based providers can be relatively easily identified because they are usually on publicly available lists. So we have a relatively strict disclosure rule that says that if there are less than 50 unweighted cases, you cannot report a state-level estimate there. So for those states, you would not be able to do a center-based analysis at the state level. Then in the middle column, those are the states that have between 51 and 99 unweighted cases. So you can do some state-specific tabulations, but probably you cannot break it down into, a innumerable number of categories. You may have some limitations in terms of the subpopulations you consider. And then on the right side, those are the states that have 100 or more cases. And in this case, the NSCCE would support state-specific analysis given our disclosure rules. So if this is clear, I will kind of let you break down into your groups again, and I will give you 10 minutes. And I will give you a warning at the 5-minute mark and the 2-minute mark. Okay, we are about the halfway point. You have about 2 minutes left. Okay, let's reconvene. Let's start with group 2 this time.
Hi there, can you hear me okay?
Yeah.
Yeah, so the first thing to come to mind was the issue of coverage of each data source, referring to that slide you showed us. We might want to limit our cases, in this case to states with over 51 cases.
Mm-hmm.
Another thing we considered was
May I ask you a follow-up there? Is your concern there the coverage of those states? So are you concerned that the states that have fewer cases do not have enough coverage? Is it kind of an issue of the representation of those cases, or is it an issue of the sample size and the disclosure associated with it?
Oh gosh, well, in the case of a large population with 50 or less cases, I would be worried about representative samples. That would be my first concern. And I would need to know more about this, the disclosure rules, to speak on that.
I understand.
Another thing we considered was the issue with a third and endogenous variable affecting the variation in our outcome of quality. So for example, we'd want to understand the interaction between state policies. So if we have generous subsidy policies, there may be a relationship there to regulatory quality policies in childcare across states. So, it may be the case that generous subsidy policy is at the expense of regulatory quality or moves with it. And so in that case, I think we would just need to do a state scan and a thorough review of policies to understand the variables that are at play.
Yeah, and in that sense, you may be concerned not necessarily about the trade-off between various policies, but whether, let's say, following your example, states that have more generous policies also happen to have better infrastructure for providers to provide better quality services. So it's not
Correct.
really the issue of generosity, but it's some other combination of factors in the state that kind of leads to both generous policies and a better quality.
Yeah.
Great. Any other comments from group 2?
None from me. Anyone else?
I have, can you just clarify, Carolina? So when you asked the follow-up question about our issue with like 15 of the states being kicked out because state level data isn't available, to me, if you're doing a policy analysis of the US and 15 states aren't included, which is how I read that slide, that's like a pretty substantial problem for understanding what effect policy might actually have. Were you asking about different concerns related to that?
Yeah, so we get asked this question, kind of a flavor of this question a lot in the NSCCE. So the NSCCE is designed to provide estimates that are representative of all states, so of each state. The issue is that in states that have very few providers, your measurement error, your standard error, whatever estimate you produce, your standard error will be large. But it's not that it's non-representative, and all states are included. So it's not that 15 states are not included, all of them are included. But some have more providers and more households than others.
But so that slide where you put that says disclosure rules prohibit state level reporting, I guess, what is that slide saying is unavailable?
So there are kind of two issues combined. One is that you may be able to do the analysis, but you may not be able to report on it. So you can do there, in Alaska, there are center-based providers, Alaska is in the NSCCE, and there are center-based providers sampled and included in the NSCCE. But, and you may be able to produce an estimate of the number, the weighted estimate of the number of children covered or the number of providers covered. But if you may be able to do that depending on kind of how your analysis is set up. But if you end up restricting, restricting your sample in any particular way, such as, let's say low-income providers, providers who serve low-income children, or providers who are of high quality or of low quality, or then you will end up with cells that have fewer than 50 cases. So in general, the disclosure rules will prevent you from reporting those estimates, and you would have to suppress those estimates.
I see. Yeah, I was totally misunderstanding the slide, and it was a very helpful clarification. So they're in there, and they could be used on a national policy analysis level as long as you were reporting out about policies or states generally with these policies tend to have higher or lower quality.
Yeah, that's a very good way of saying what I said. Yeah, and in fact, you may be able to aggregate. So you may not be able to analyze Alaska on its own, but if Alaska has similar policies than other states, you may be able to combine a subgroup of states and analyze the relationship between reimbursement rates and quality for that subgroup of states. But it's not that Alaska is not in the sample.
Yeah, which makes total sense in hindsight. It's just when I read that slide, I was interpreting it off the cuff as it being kicked out of the state level analyses, but that makes a lot more sense. There's no reason.
Yeah, this is a great point because we get asked this a lot in the NSCCE, and kind of disclosure guidelines somehow get mixed in or confused with, the cases being there. Any comments from group 1?
So I guess I'll speak for group 1. In terms of the purpose of the linkage, we discussed that it would be either outcome or covariate because similarly to example 2 from the previous brainstorm, it's not obvious how the causation is running. It could be that a state with terrible quality of center-based providers suddenly decided that they need more generous policies, in which case the causation would run from quality towards the policies, or it could be the other way around, that a state that has had more generous policies for a while is seeing the impact of it in better quality of providers. So it's not obvious which one is which. So it's so the purpose would be one or the other. And then
and a related issue there would be the timing, you know.
Yeah.
As in the way that you were expressing it would be kind of, you know, when, I mean, the NSCCE obviously took place in 2012, but depending on kind of when you're measuring the policies, the correlation could go either way.
Right. Yeah, that's true. I guess if you collect the policy data much later, then the causation would be more clearly from one to the other. Yeah. And then for the feasibility considerations, we focused on sample size because there's only 50 states in the US, so that's very small. Potential solution for that, we thought we would keep the data, we would not aggregate the data at the state level for the programs, but we would try something like a random effects ANOVA, where the state would be the clustering variable, but we would still have program level data for the quality. And then the other feasibility consideration would be data quality, because the NSEC data, the program quality data, would be self-reported data. So the programs would have incentive to overestimate the indicators of quality. And then what was the other one? Oh, and then we thought that the potential solution to that would be to like a separate linkage on some of the quality indicators with some administrative data to see what size of discrepancy would be sort of showing up in the survey data. And then the last, what was the last one?
So that would allow you to kind of compare the observed quality or some quality rating by some particular agency with the self-report that the providers gave in the survey. I understand.
Maybe some sort of a quality rating, the QRIS data or something like that. Then what was the last one? Yeah, I forgot the last one. Maybe someone from group one can fill in if I forgot the last.
I think one of the challenges for, I think the QRIS example is a very good example of kind of understanding data quality on both the observed and the self-reported side. I think one particular concern there is that the centers that may have lowest quality may not even be in the QRIS.
Right.
But you don't know necessarily that. So it's somehow correlated with your outcome of interest. The coverage of the administrative data.
Yeah, we talked about the coverage. I forgot what exactly. Yeah, we did talk about the coverage, but I forgot what exactly we said about it. So I think that would be all from.
That's great.
Our group.
Well, those are very good points, very insightful. I think some of these issues of unit of analysis will be covered in the next session. The issue of disclosure will be in the session right after that. So this is not the last time that you will hear about it. I think from the point of view of this session, we wanted to make sure that you understood kind of the analytic feasibility of the linkage. And so as I said, the next session will cover units of linkage and units of analysis, and also the measurement issues associated when you link survey data with administrative data. And that will be on Monday, the session number 4. So for your project assignment, I think that there are kind of 2 issues that you may be able to make progress on based on today's session. So one is to specify the purpose of that for your specific project. What is the purpose of linking survey data and administrative data? And you may use the framework that we discussed today, or it may be a combination of uses and purposes from what I said today. And how does the purpose of linking survey and administrative data affect your analysis plan and your requirements on data quality? That's kind of on the why. And then for the feasibility, it would be good if you could conduct a calculation of the sample sizes you expect to obtain from your linked data set. And I had said the back of the envelope calculation is fine. And you may want to be aware of kind of how you are defining your analytic sample. Do you only care about the cases that are matched? Do you care about the cases that are matched and not matched? How are you thinking about that? And that will inform the sample size you end up with. And here in the slides, I added 2 references that have a very good discussion of the different purposes of linkage. Both are available in PDF online. The first one specifically focuses on linkage to improve research on families and has some very interesting suggestions about how administrative data can help to identify various families and different forms of families currently available, currently happening. And then the growth chapter is in a part of a book from the National Academy of Sciences that is also very good, and it describes different purposes of linkage and various limitations. Any other questions or comments from the group, or Amber, do you need to wrap up?
Yes, thank you, Carolina. Everyone, please remember to fill out the evaluation for session 3. It's in the announcements. Your feedback is very important to us, and we look forward to Monday's session.
Okay, see you all later. Thank you very much.